Hey everyone, I am Dr. Jared Pello, Chief Medical Officer for Bionic Health. I'm really excited that you have decided to spend some time with me today. I'm excited to talk about longevity medicine, precision medicine, and bionic health and what we do to help you achieve your optimal health. And as you see here, our mission at Bionic Health is to enable optimal health for all, and that includes you. So let me jump right in. I want to start off. We're going to talk about why we exist, what are the flaws in the current healthcare system, and why does Bionic need to exist because of those. A little bit about longevity medicine, how to think about it, the prevention tools that we use, our solution, the science, and some case studies for you, and then how you can take action today. And we'll finish up with some question and answer and closing. So on today's presentation, I'm going to be doing this alone. So these questions came in beforehand, but I'm excited to share them with you. So let's go ahead and jump right in. So first off, just what is longevity medicine? Is longevity medicine living a long, healthy life, or is it just living a long life? And I think that we can all understand that there's a big difference between just living a long time. And there's science fiction movies and books about people downloading their brains and living is just ahead. And, we also have in real life, we have scenarios like locked-in syndrome and ALS, where people don't get to live that healthy lifestyle. Now, it doesn't mean you can't have a wonderful life like that. You absolutely can. But many of us find so much joy in a healthy, strong body and in the ability to use our body and to have good health. And longevity medicine is really figuring out how do you have this first scenario where you're vibrant and healthy and not stuck in a hospital room. And Bionic Health exists really to enable optimal health for all. We believe that in this world, this big, wide world, there are many things that are needed in healthcare. One is basic medical knowledge around the globe. And we're working on AI that will help with those things. But in the US specifically, there is this goal that many have to have optimal health, and they don't know how to do it. And there's lots of disparate services. So you could sign up for Inside Tracker, but there's no doctor attached to that. You can call Teladoc, and they know very little about you, and they might help you get the right nasal spray for your sinus infection or your allergies. But what we're talking about is a service that knows you deeply, backed by AI that helps physicians make the right decision for you. A service that looks at your full genetic profile, taps into your fitness tracker, and really leverages the best of behavior change, of medicine, of the current science in helping you live the optimal life for you health-wise. Now, what's wrong with traditional medicine? Well, it's hard. It's hard to deliver medicine at scale. And our medical system is very fractured. It's very regionalized. And in medicine today, by no fault of anyone, I am a big fan of everybody who's engaged in medicine for the most part. There may be some bad actors out there, but everybody for the most part is trying to do their best. And physicians really want their patients to be healthy. They don't have time. The average physician has about 5 minutes per year that they can listen to their patient. That's crazy. When you stop and think about 5 minutes per year, I'm listening to my patient. How am I supposed to know much at all? And also, the physician only has about 5 minutes a year to talk to the patient. Can I coach anybody on how to be healthier or better in their lives if I only have 5 minutes? Well, there's also the fact that it's so extremely expensive because there are so many hands in the pot. The way insurance works today, and it's crazy, insurance doesn't work this way for your car, for your home. The way we use health insurance is actually as a delivery mechanism and as a payer. You don't use your car insurance unless you get in an accident. You don't use your house insurance your homeowners, unless something happens. But we use medical insurance to help us do everything for medicine. Now, whether that's the right way to do it or not, that's just the way it is. But so many people spend so much money outside of insurance to try to achieve optimal health. We know that, supplements are a huge part of the economy. We know that medical spas and other treatment modalities are all so big. And it's because everybody's looking for kind of personalized medicine just for them. And at Bionic Health, we believe that we can create something that is cost effective so that you can receive similar medical care to what like a movie star or somebody who's worth millions receives, and receive it for an affordable price, where somebody making, $60,000 a year can actually afford to use Bionic Health. And why do some people live longer? Why do some people live longer and healthier? And you've probably all heard of blue zones. There's these places around the world where there's these pockets of people that seem to live longer. Well, they don't just seem to live longer, they do live longer than average. And there is an increasing number of centenarians, that's people over 100 years old. And that is growing, which is exciting news. And some of that is because we're better at screening for cancer, we're better at taking care of heart disease. Much of this is determined by our genetics. And much of it is determined by who we're around. And there are ways to optimize towards having a longer, healthier life. And I think it takes a very structured way of thinking about it. It doesn't just happen by luck. For some people, it does. Like, you've all heard the story of the person who's smoking their cigar when they're 100 years old, and they say, my secret to 100 years was a scotch every night at dinner. And I know a lot of people who drank scotch and they didn't live to 100 years old, but there are those outliers. And it used to be that being a centenarian was about the same as winning the lottery. Your odds were very, very low to live to 100 years old, but it's becoming much more common. And that is thanks to modern medicine. But there are things that we can do to help ourselves, and we may not all live to be 100, and that's fine. But I think when I think about my later years, it's not necessarily the goal of living to 100. It's living healthy as long as possible. And it's actually something called squaring the morbidity curve. As a Stanford professor way back in the 70s that started talking about, can we make it so that we are sick for the least amount of time towards the end of our life? And that is really the goal of kind of precision medicine and longevity medicine. And for me, the first rule to living longer is don't die from causes that can be prevented. And up here on the pictures, I have many different things that I believe can be prevented. So first and foremost, the biggest killer in the world is heart disease. And there are really three things you need to do to prevent heart disease. It's not that complicated. Don't smoke, number one. Number two, make sure you have normal blood pressure, which is a little bit more complicated to figure out than it may seem. And number three is make sure that your apolipoprotein B, a type of carrier of cholesterol, is as low as possible. And if you do those three things, then you don't end up with vascular disease and you don't have a heart attack or a stroke. So that's number one. Number two is cancer and cancer screening and how important that is. We know that if you catch a stage 3 cancer, you might be cured. If you catch a stage 1 or 2 cancer, you likely will be cured. And so much of it comes down to how do you screen for cancer? And so we think deeply about that. We help you figure out what is the optimal screening mechanism for you. You might just think, well, I'm just going to do whatever the federal government tells me to do or whatever the different medical associations say. So that's a colonoscopy every 5 years, starting at age 45 to 50. And that's a mammogram every year, starting at age 40 to 45, depending on what you look at. That's, annual skin checks or skin checks every 3 years or, all these different things. But you need to be very precise. You need to understand what is your risk compared to the population and what are the strengths and weaknesses of the screening mechanism that you're using. We're going to help you figure that stuff out. Next up, don't die of dementia. There are things you can do today, even if you have a genetic predisposition, even if your grandma had Alzheimer's, even if your grandpa had Alzheimer's, there are things you can do to not end up with Alzheimer's. And much of that comes down to the diets we eat, to the way we exercise, to making sure our omega fatty acids are at the right levels, making sure we don't have more inflammation than we need in our bodies. And we're here to kind of help you figure that out. The next thing to me is really metabolic disease. And that's how does our body use nutrients, and mainly glucose and insulin? How do those work in concert? And closely aligned with that is muscle. As we age, we go into something called sarcopenia, which is a loss of muscle mass. And you've all seen this as you've taken care of older people in your life. When they get sick and they end up in the hospital, they come out, they're weaker, and they rarely get back to where they were before. And it's this gradual slope downwards. And so the goal is really go into your older years with as much muscle mass and strength as possible. And as soon as you get sick, as soon as something happens, try to get back on your feet and get that muscle mass and that strength back. And you really can do those things. And so, like I said at the beginning of this slide, the first rule to living longer, don't die from a preventable cause. And that's what we work on. Because I truly believe that all of us, while we may not live to be 120 or 150, and there may not be scientific breakthroughs that help us live that long, all of us are potentially leaving 10, 20, 30 great, healthy years on the table when we don't take care of these things. These are things that if we take care of, we can have decades of vibrant life that other people who don't do these things don't have. So longevity, preventative, and precision medicine brings all of these different things together. So we want to first prevent you from dying from a preventable cause. But then second, how do we optimize your health today? How do we make sure that you're vibrant? How do we make sure you're taking the right supplements? And should these supplements be based on your genetics? Should they be based on your habits? Should they be based on your goals? What medications should you be on? What kind of diet should you eat? All of these things need to come together to really understand what is the right way for you to do it. And there are doctors that will do this for you today. And those doctors cost anywhere from $20,000 to hundreds of thousands of dollars for you to get this type of attention. And our goal at Bionic Health is to make this, less than $1,000, so that you can get the kind of care that you deserve, because we all deserve the best care. We just can't all afford it. And it's just because doctors don't scale. Our brains don't scale. We're humans. But with the advent of AI, large language models, the ability for pharmacogenomics and nutrigenomics and all of these things that are happening so quickly in longevity medicine, I truly believe that we're in this beginning, this dawn of a golden age. And it's going to become much more affordable, just like the cell phone. Used to be so expensive. Now people in the most impoverished areas in the world have cell phones and have cell service and have smartphones. And I believe that this type of medicine will become democratized. And that is what Bionic Health is all about, trying to make that happen even faster. So the Bionic Health solution today includes a mobile application where you have your physician available to chat with, talk with. At any time of day, you can send a message. You'll get an answer back within 24 hours. You get advanced lab work done, imaging, wearable integration, easy to understand goals, somebody that's going to help you achieve your goals, precision treatments, and always expanding capabilities. This is early days for Bionic Health. I think what we've built is really amazing and really great and many times better than typical medicine. But I think 2 or 3 years from now, it's going to be like the difference between an iPhone 4 and an iPhone 15. iPhone 4 was good. It was really good. But the current iPhone is much better. And you're going to see that with Bionic Health. What you will receive today is way better than a flip phone, right? Bionic Health is way better than typical medicine, but it's going to continue to get better and better, especially as we ingest more and more of your data and use AI to see patterns that physicians just can't see because there's so much data there. Now, why do I feel confident that we're going to achieve this? A big part is the team that we've put together. I have some of the smartest people in AI, in medicine, in exercise, in all of these things. People like Peter Lee, the head of Microsoft Research, Zach Cohane, the head of bioinformatics at Harvard, Tara, who is known as the hormone guru, Abby Smith Ryan, an exercise science professor at UNC with expertise on exercise nutrition and body composition, and longevity experts. I'm so excited about this team that we're building, and we're going to continue to build this team of experts out. And what's so cool is you don't have time to meet with each of these people one at a time. But that is the power of AI. We can take a knowledge base, we can take their expertise, and we can apply it to you personally. And that's what we do at Bionic Health. So let's talk a little bit about outcomes. We started in March. It's been very little time, but we have already helped many of our members. People come in with different goals. Some people want to change their body composition. They want to add muscle, lose fat. Other people want to decrease their risk of death. In our population, for some reason, we have a very high Lp(a) rate. That's a specific type of lipoprotein carrier of cholesterol that is an independent risk factor. There is no medicine for this today. There are trials ongoing, stage 3 trials for medications for this. And we've been able to identify this in several people and lower their risk factors of having heart disease, having a heart attack. We've been able to also help people lose 10% body fat in a year. And some of that with medication, some of that without medication. And we're all about using the right tool for you to help you achieve your goals. I don't think that there is anything in medicine that is inherently bad or inherently good. It's all about how you use the tools. And you have to have the expertise in using those tools correctly. And so medications, while at times could be the wrong thing and a crutch, at other times it could be exactly the right thing. And sometimes just a stepping stone, sometimes just something you need for support in the short term to get your body healthy. And then sometimes you're able to come off those medications. And some of those are some of the outcomes we've seen. We've seen people need to go on blood pressure medicine and be able to come off blood pressure medicine. It's been a very short period of time, but we've seen tremendous outcomes so far. So what do I recommend for you? Say you don't sign up for Bionic Health, which is absolutely fine. Bionic Health isn't for everyone, but here are some things that I'll recommend for you. Number one, focus on eating whole foods. Focus on eating foods that our ancestors would have eaten 100 years ago. That doesn't mean paleo. It doesn't mean a specific diet or demonizing a specific nutrient. I'm not saying carbs are bad or protein's good or any of those things. What I'm saying is eat whole foods, fruits and vegetables. I really love the 800-gram challenge. That means you spend your day trying to fit in 800 grams of fruits and vegetables along with good proteins. I personally eat meat. If you don't eat meat, if you are a vegan or vegetarian, then focus on getting high quality proteins. The next thing for me is really about sleep, which is the foundation of everything. We know better now than we've ever known before how important sleep is. It's not one of those things you can, sleep when you're dead. If you do that, you're going to die faster. So focusing on sleep is really good. The next thing up, I have kind of two things here in this picture. That's living an active lifestyle. Now, I've seen many people go from couch potato to whatever it is. 5K, 10K, just being an exerciser. And what I recommend for you is just do a little bit more than what you're doing today. So if that's nothing, get up and make sure you walk 5 minutes a day. If you're running 2 miles a day, well, then start thinking about doing some zone 5 exercise so that you make sure you increase your VO2 max, which we know helps with longevity. The other thing that you see in this picture is mindfulness. Now that could be mindfulness in the form of meditation, could be mindfulness in the form of prayer or spending time outside, but really focusing on what it is that your body is feeling and noticing what's around you, trying to disconnect from your ego and really and what I mean by ego is that inner voice, try to disconnect from that and really just pay attention to your body and the world around you. Spend some time every day on that, whether it's a minute or a half hour. Spending some time on that is really great. And then the last thing I have here is find a guide. There are many gurus in the world today. Maybe you read a book or listened to a podcast, and you may have some people that you think, these are the people I trust. And for the most part, I bet they're great. And some of them are going to tell you things that are going to be hard to implement, that are going to be past the level that you can implement. And what we've tried to do at Bionic Health is make it super approachable for anybody at any level, no matter where you're at on your health journey. And if it's not Bionic Health as your health guide, try to find somebody, whether that's a health coach or a physician or somebody in your life that can help be your health guide. So why and how to become a Bionic member? This isn't the best slide just because you can't see our feature comparison really well, but you see that Bionic Health on our webpage on pricing, you can see this comparison table where we compare ourselves to primary care, concierge medicine, some competitors out there like Wild Health, Inside Tracker or Function Health, and Fountain Life or Fount Bio. Now, to me, they're all great services. Honestly, I have no problem with any of them other than many are expensive and many are incomplete. So what we've tried to do is build something that is much more affordable. And as you'll see, we have transparent pricing. We tell you exactly how much we're paying for labs, physicians, advisors, and our platform. And I can't think of many businesses that tell you how much money they're making on you, but we do that. And we do that because we don't believe that healthcare is transparent enough. If you call your hospital and you ask how much something costs, they may not be able to tell you. And if they tell you, you might get a bill and it's going to be completely different. And the insurance company is going to pay something completely different than that. And we just don't like that. We're not going to play that game. So we are very transparent in our pricing. So if you're in North Carolina, that's the only place that we practice medicine today. We'll be going to Virginia and South Carolina in the not too distant future. So feel free to sign up for our waiting list. But if you're in North Carolina, sign up, become a member, and we'll help you achieve your optimal health first day and really try to help you achieve optimal health going forward in the future. So some questions and answers to go through. So I just have a few questions here. One question is, what is the right diet for longevity? Now, this is really a hard question, and it depends. It depends on you. It depends on how good your body uses glucose today. It depends on what you want to eat. Do you want to be a vegetarian? Do you want to be a carnivore? Do you want to be an omnivore? It depends. I think there are some generalities, and I gave you one of those generalities, which is try to eat whole foods. Try not to eat processed foods. Try not to eat too much saturated fats. Monounsaturated fats seem to be really good. There's a few studies like the Lyon study, which looks at the Mediterranean diet, which is a whole foods kind of diet. So if I were put in a box and said, you have to choose one diet that you should recommend to people, I'd probably recommend the Mediterranean diet. But honestly, to me, all foods fit, and what that means is you can eat pizza. You can eat a hamburger. You just can't eat pizza every day for every meal. And you just can't eat a hamburger every day for every meal. And you can eat cake, but not every day for every meal. So I think you can have, sugar in your life. I don't think that sugar is poison. It's a nutrient. Carbohydrates are a nutrient. And so I think that there is room for any food really in your life if you eat it in moderation. And learning how to moderate, that might take a lifetime, and that's okay. It just takes time. Next question, what medications, if any, can be used for longevity? Now, this is a really interesting question. There are several medications that have been studied and are being studied. I think some of the most promising, the metformin trial that's ongoing, the TAME trial, is a very interesting study because it's the first study where we're looking at a medication primarily used for signs of aging and hallmarks of aging. And so that'll be interesting to see what the outcome is. It's an ongoing trial. I think we have another 3 or 4 years of collecting data. Probably won't have that paper published for about 5 years, but that will be a very interesting trial. In kind of epidemiological studies that have come out of the UK, there's been indications that metformin might be a longevity drug, but there's also been a more recent study that kind of disproved some of that. And so what I think with metformin, for instance, is if you have trouble with glucose, I think it's a great drug. If your hemoglobin A1C, which is your average glucose level in your blood, is high, or you wear a continuous glucose monitor and your average glucose is high, then I think metformin is a great drug, especially as you build muscle and you really try to make it so that your body can handle glucose better. Another drug that is super interesting is sirolimus or rapamycin. And this is an interesting drug because in the ITP, which is a mouse study that happens at 3 different centers, and there have only been a few drugs that have shown really robust longevity in these mice, and rapamycin was one of them. There's also a lot of anecdote around people taking rapamycin and having better biomarkers. Rapamycin is currently used and FDA approved for anti-rejection after a transplant. But it's a very safe drug, and it appears that once a week to once every 2 week dosing would be what would be used for longevity. It's a drug that currently is not FDA approved for longevity, but there's a very interesting study from Matt Kaberlein out of Seattle. He was at the University of Washington. He's still doing the dog study where they're looking at rapamycin in dogs. And what will be interesting about that is these dogs live in homes, and so their environment is very similar to humans. And as that data gets published, we'll have an even better idea. And obviously, dogs are much more like humans than mice. So we'll have a much better idea if rapamycin is really going to be a good drug for longevity. And there are lots of other drugs that are being looked at, drugs that are exercise mimetics, meaning they make your body think that it's exercising or have the same kind of benefits that exercise have. And so there's a lot of good studies ongoing. And I think that we'll see more and more. And you hear things from, doctors like Dr. Sinclair, who's a PhD out of Harvard, Dr. Hyman. You'll hear about different medications, supplements, taurine, resveratrol, quercetin, fisetin, NMN, NR, all these things. Like, do they help? Well, we're not always sure. And so it's really comes down to figuring out what's the right risk, what's the right benefit for you. Is it worth trying? And at Bionic, I'm mostly okay with people trying almost anything because we track them so closely. We're doing labs every 3 to 6 months, depending on their plan. So we can really keep a close eye on anything negative happening and keep track of positive things happening. Next question is, what is your opinion on aging clocks? Now, if you don't know what an aging clock is, aging clocks look at different things. They can be methylation or glycylation kind of clocks. And what those are methyl groups, carbon and oxygen groups that are put on different proteins. And they look at this on DNA and proteins and try to determine aging. And the studies that came out that have kind of proven aging clocks are a thing are interesting. But we have no long-term data to show that aging clocks really work in telling us, are we biologically aging at a different rate than chronologically aging? Now, it seems that some people do biologically age at a less rapid rate. And that can be lifestyle issues, and that can be genetics. And so I think these aging clocks are really interesting. I'm not necessarily bought into any of them at this point. I hope that we'll continue to get good science that tells us. They're very expensive, And so for me at this point, it really comes down to I can tell a lot just from basic biomarkers that I can get done at LabCorp or Boston Heart Lab. And that's enough for me at this point to tell you whether you're healthy enough or not. So, and then with physiological testings like VO2 max or, a body composition test like a DEXA scan, I can really tell you a lot about your health. So if you have any more questions, please reach out. The QR code will take you to our sign up page. It's been a pleasure to spend the last little bit with you. I hope that you were able to learn something about Bionic Health, and really hoping the best of health for all of you, and enabling optimal health for all is our mission, and that includes you. Take care.